Hi, I'm Dr. Anthony Cave, a Stanford and Harvard trained board certified anesthesiologist and integrative medicine specialist. That means that I'm an expert in both Western medicine, like here in the operating room, and Eastern medicine. And I get a lot of interesting questions from patients, like are supplements just a waste of money? Does acupuncture really work? And is this all just hippy dippy snake oil? From the other side, I also get patients who think I'm just a pill pusher who gets paid off by big pharma to prescribe medications, and that I just blow off patients so I can see the next patient faster. I spent over 10 years mastering Eastern and Western medicine so that I could give patients the medicine that's right for them and that's in line with their preferences, and not just pushing my medical agenda on them. So here are the medical secrets behind Eastern and Western medicine that help me decide what medicine to use for my patients. First up is Western medicine. Absolutely the winner when it comes to acute medical care. Think the emergency department or the operating room, like gunshot wounds, being hit by a car, or bleeding out when you're on the operating room table, like in this operating room that we're in right now. In Western medicine, we've reduced all the natural medications out there into highly specific molecules that do what we want when we give them. This is really good when you're in the operating room or when you're in the emergency department. Think like a stroke or a heart attack. But it comes at a cost. Not only is it super expensive, but when you have powerful medications, you also have powerful side effects. I can offset some of these side effects with natural medicine whenever possible, even here in the operating room sometimes. But overall, Western medicine does really well in this small fraction of medical care. So while Western medicine is really powerful here in the hospital, it's not so powerful at home where you live most of your life. When you're at home, you want medications that are gentler, that don't have as many side effects, and also don't cause you to go bankrupt. In the United States, more than 50% of bankruptcies are in part due to medical expenses. And in the US, medical expenses are almost 20% of our GDP. And the biggest secret that no one talks about is that when we prescribe medications, we're actually changing our patient's mind and body. When you get a prescription, like for a blood pressure medication, you might be less likely to exercise and to eat healthy foods that would otherwise naturally lower your blood pressure. So it's not just like we're prescribing medications, we're affecting our patients' choices of how they're going to live their life, sometimes without us doctors even knowing the effect of our prescriptions. So to sum it up, Western care is really good in an emergency, not so good at empowering patients to take control of their own health outcomes. How about Eastern medicine? Now, when I say Eastern medicine, it's not just China, it's also South Asia, the Americas, and really all over the world. It's more of a holistic medical view. And this holistic view is powerful, not just for heart health and brain health, and especially mental health, but also autoimmune diseases and even your skin health. There's heavy emphasis on prevention. In fact, we say an ounce of prevention is a pound of treatment. And we tend to use more natural medications like herbs or botanicals and mind-body techniques. Think acupuncture, tai chi, meditation, etc. This does come at a cost though, and that's delayed gratification. It's not like Western medicine where when I give propofol, I know exactly what's going to happen and when it's going to happen. In holistic medicine, when I'm using more natural medications, maybe valerian or magnesium for example, the effects are going to be gentler, take more time to build up, but they also don't have the same cost or the same side effects. And they're typically not used alone. It's not like one medication for one disease. I'm combining supplements with diet and mind-body techniques. And the really cool secret that no one talks about for Eastern medicine is that one intervention isn't just for one disease. Like in the West, they'll give albuterol to help asthma. One intervention, one disease. For more holistic practice, I use one intervention for many diseases. Think lavender, melatonin, curcumin, or turmeric, or an anti-inflammatory diet. Each one of these interventions affects all parts of your body. Your heart, your brain, your lungs, and your skin. And because these interventions are gentler, usually coming from natural plants or supplements, they tend to have fewer side effects and cost less. And at the end of the day, I want my patients to take these interventions to ultimately tap into their own inner healing potential. That's going to be a lot more powerful than most things that I can ever prescribe, and it costs a heck of a lot less. So what are the controversies between Eastern and Western medicine? For one, Western medicine is really expensive like we said, but if my patient's dying in the emergency department or in the operating room, I'm pulling out all the roadblocks and I'm going to do what it takes to help save their life, obviously. But for patients with chronic disease at home, I want to max out a holistic approach as much as possible. Things like botanicals, supplements, sleep medicine, mind-body techniques, the list goes on. It's ultimately whatever resonates with the patient. So as you can see, the best best medicine is to combine the best of the West with the best of the East and integrate them together. It's why we call it integrative medicine. On the other hand, pushing your agenda from one side or the other and not listening to what the patient wants or needs is probably not as effective. And the worst is to mock the other side because you never bother to learn what they're advocating. My advice to you is to find a healer who can empower you to discover how much potential you have to heal yourself, combining the best of Western and Eastern medicine. And leave a comment below if you want to learn more about Eastern versus Western medicine.